In this video, I'm covering a condition called Maigne Syndrome of the lower back, which is common amongst people who have had long-standing back issues, but now it's manifested as a different type of condition. It's similar to people who have facet irritation as well, and the mechanics are very similar as well. So I'm going to describe a little bit of what that feels like today, as well as show you how to use something like a ball to show better mechanics before doing any rehab exercises, because how you do them are going to be very important. Hey everyone, I'm Sebastian in Performance Place Sports Care, part of locally world famous chiropractors in Costa Mesa, California. We do telehealth and in person. Now, when we find people with Maigne syndrome, like what we typically find is they're very good at having a default of lumbar extension, plus the same thing is anterior pelvic tilt. They become this person. And you may actually notice if you look at my lower back, like my muscles are just contracting like heck just to be in this. But sometimes it's a position it's a remnant of an older condition, an older long-standing lower back condition. So what happens is this bend point up here becomes so compressed that eventually they have symptoms that sometimes radiate and sometimes go into this area, sometimes they go into the front of the hip crease as well. The way to resolve this typically goes along, number one, with awareness of what it is, but number two is being able to change your pelvic position and just being able to set that up prior to your exercises. So there's endless ways to coach this. I'm going to show you with a ball. In some other videos, I've showed you other ways. But you notice this ball here, right now, it's kind of like in a sinkhole in my lower back. This sinkhole couples with anterior pelvic tilt. They're the same thing, okay? Now, if I just flatten this out a little bit, I'm going to try to do it without actually dumping the ball off and chasing across the room. But that can get me to a little bit more of a neutral. You can see the ball is kind of like resting on my belt line now. If I were to pull my shirt up, you can see that my rib cage is no longer flared. Let's see if I can keep it to the ball. See, when this ball kind of slides back and the lumbar spine extends and the booty pops up, that the rib cage pops up too. All of this goes hand in hand together, okay? So what we want to do is find a position where we can kind of be in neutral here. Usually we have a little assistant with us, or once you kind of get the principle, you don't really need the ball quite as much. So I kind of get it, right? So I'm here, I want to be in the middle somewhere. You don't need the ball, it's just a teaching tool. So here, we may end up doing stuff like our bird dogs, okay? I know plenty of people with Maigne syndrome where if they do bird dogs, it just hurts terribly, but they tend to do it with a lot of this going on. So we want to make sure that we keep a little bit more of that neutral, build a little bit of internal pressure here, which if you need to understand that a little bit more, we have a PDF it's a webinar that we have where we cover it in more detail, because I know a lot of you don't want anatomy teachings on these videos. You want to see some exercises and movements, okay? But essentially, building that intra-abdominal pressure through the ball socket dissociation of the shoulder and the hip actually matter quite a bit. And that's the purpose of the exercise. But if you do it like this, it's going to feel terrible. Now, another way you can actually find more of a posterior tilt and anterior tilt, differentiating between the two, is going to be just something with like laying on your back in this position. Now, as you can see, my ribs are popped up. That means I have all those three things happening right now. If I'm here long enough, especially people with Maigne syndrome, they lay on their back or they twist around in bed, like the rib pop up is just an extension pattern. It's not bad, it's just like they're not tolerant of it right now. So what they may find is if they sink the rib cage down with an exhale, breathe in and fill this cavity full of air, and then go into a little bit of anterior posterior tilt. I can still do an anterior tilt without having the rib flare happen, which is kind of what we want, more of a protected anterior tilt. Now what we can do with this once we have the anterior posterior tilt is we can make this into an exercise too, which is a dead or dying bug. So a dead bug is a bug that doesn't move because it's already dead, so it's going to be something like this, right? So in this position, since everything is flexed up, most people feel okay in this position. It's when they start to bring their appendage down which they don't, because it's an extension position, okay? An extension position makes it so the rib cage has more potential of flaring or the hips rock into the anterior tilt. So we're going to stay in this dead bug position first, just for about 30 seconds, to make it so we can still keep this area full of air. Okay, and I would really encourage you guys to, I know I'm talking a lot through this because I'm trying to give you context, but when you do this, don't talk to anybody. Just focus on the pressure and the position. Okay, the next thing we're going to do is we're going to challenge to see if we can actually make the bug start to come back alive. We should call this the zombie bug, since it's probably more of a progression of the dead bug. But I can tell right now doing this, my back doesn't like it. Okay, so I can tell you from full certainty that if you start doing an exercise like this and you start feeling your symptom, you need to change how you're doing it, or the exercise is too hard for you. So I'm a little discouraged because I thought I was going to be able to do this today. Let's see if I can change it a little bit to make it more acceptable to myself. Okay, so that feels okay. So maybe I was just up there too long in the beginning and I was starting to tank, like my tissue capacity wasn't bueno anymore. And perhaps that's the reason why my hip's been hurting, right? So if this doesn't work, I can also double down and use my hands to help enforce a little bit of that core support. But I can see right now that it's starting to go to my SI joints again, so I was up there for a while. I'm going to take a 5-second break. Fill the cavity, up again. And this feels okay right now. I'm breathing into the floor to see if I can get some more reps in. And that feels okay there. So as you can see, exercise may have to be tinkered with. The trouble with doing it on your own is that not everybody knows exercise progressions, regressions off the fly. Like you need to be able to off the fly. I can tell you with full certainty that people who can't do this shouldn't be doing this. Like they're not, like this is much harder. The lever's longer. So there are regressions and progressions that you need to be aware of if you're going to program and coach your own exercises. So those are the two things that I would suggest with mains, at least if we're talking about some of the good starting points. Now, as you can see, how you coach it is important. So if you guys want help, virtually or in person, we do have help for you. I'll see you next time.